Imagine doing everything right to eat gluten-free, yet still experiencing symptoms or feeling unwell. It can be incredibly frustrating to suspect something is off, especially when you are so careful with your diet. This often leads to a crucial question for many people with celiac disease. Yes, for individuals with celiac disease, even tiny, hidden amounts of gluten can indeed cause significant damage to the small intestinal lining. These microscopic exposures, often not immediately noticeable, can trigger the autoimmune response that defines celiac disease, making strict avoidance absolutely essential for long-term health. The core reason lies in the autoimmune nature of celiac disease. When gluten is ingested by someone with this condition, their immune system mistakenly identifies the gluten protein as a threat. This triggers an inflammatory response in the small intestine, leading to damage of the villi, which are tiny, finger-like projections responsible for nutrient absorption. This damage is known as villus atrophy, and it reduces the intestine's ability to absorb vital nutrients, regardless of whether the gluten exposure was large or just a minute amount. To effectively prevent this silent damage, proactive steps are key, especially regarding cross-contamination. Always use dedicated gluten-free cutting boards, toasters, and cooking utensils to avoid transferring gluten from shared items. Clearly label gluten-free ingredients in your pantry and refrigerator, and consider having separate condiments like butter or jams if others in your household consume gluten. When cooking, prepare gluten-free meals first to minimize the risk of airborne flour or crumbs contaminating your food. It is important to remember that for celiac disease, there is no safe threshold for gluten exposure. Even levels as low as 20 parts per million, which is the standard for gluten-free certification, are considered by some to be the very upper limit. Regular, low-level exposure, often referred to as silent damage, may not cause immediate digestive upset but still contributes to intestinal inflammation and villus atrophy over time, highlighting the importance of unwavering vigilance. Understanding that hidden gluten poses a real threat empowers you to implement thorough prevention strategies. By consistently practicing careful food handling, ingredient checking, and cross-contamination avoidance, you actively protect your intestinal lining and ensure your body can properly absorb nutrients. This diligent approach is fundamental to managing celiac disease effectively and maintaining your overall health and well-being.